Countries have raised concern, as I had alluded earlier, with some of them suspending, including very own Uganda and South Africa, and a lot of European nations have suspended the use of the Oxford AstraZeneca vaccine. But what are the concerns that have been raised when it comes to this vaccine? That is exactly what we will be looking at. Remember, we are live from the Broadcasting House in the county of Nairobi. We're also live on all our social media platforms, including Facebook, Twitter, YouTube, and our KBC app. Kindly, let's look at this issue as it is continuing to unfold in various countries. And to help us dive into this discussion, I'm joined by Dr.Nazila Ganatra, who is the head of department at the National Strategic Public Health Programs. Karibu sana daktari.
Asante sana Njue.
And perhaps to start us off, on 3rd of March, that is when the first COVID-19 batch arrived in Kenya. And last week, I think it's last week, we also got 100,000 vaccines from our very good friends. But have you received any concerns, or have you had any concerns raised just the same way that we are seeing some countries raising concerns on the efficacy and perhaps the side effects of this COVID-19 vaccine?
Thank you very much for this question, Mr. Njue. I'd like to reiterate that we registered, we have the regulatory authority in Kenya, the Pharmacy and Poisons Board, which actually registers this vaccine. And the registration is not based on a haphazard kind of registration process, but the registration is based, of course, on the WHO emergency use listing, as well as other stringent regulatory authorities. The Pharmacy and Poisons Board does due diligence on the safety, efficacy, and quality of the medicine, as well as the vaccines or even other medicines and health products in the market today. So the safety, efficacy, and quality were established before the registration in the country for the emergency use listing.
And perhaps we can have a quick listening to what the CES had to talk about when the vaccines arrived in the country on 3rd of March. Actually, he was there to pick up the vaccine and talked about now we have changed the game from using old equipment and old tactics to fight COVID-19. And now we are having something stronger in the COVID-19 jab. If my director can cue that in, we can listen to what the health CS had to say about the COVID-19 vaccine. But as we wait for that, how has been the distribution of the vaccine? We heard that, of course, the frontline workers, that's the healthcare workers, the teachers, and the security forces were the first in line to receive the jab.
Yes, so we have a concrete COVID-19 vaccine deployment plan in place. And we are planning to roll out the vaccine in 3 phases over the 3-year period, starting this year, 2021, and ending in 2023. So the first phase, which is going to end in June, we are targeting the essential workers, which include the healthcare workers, as well as the teachers, the uniformed forces. And the second phase, subsequently, persons over the age of 50, persons over 18 who have some comorbidities, for example, obesity, high blood pressure, cancer. They are also included in that phase. And then the third phase is persons who are in congregate settings, such as the prisons and informal settlements. So that is how we have aligned the phases. However, the phases may be able to overlap at some point once we get the vaccine, adequate doses. As you know, that we have received 1.02 million doses in the first phase. So, and we have already placed orders for the subsequent orders. So once the vaccine is available, depending on the supply, then we'll be able to sort of even merge the phases. So that is basically the plan of action. And the distribution of the vaccine, we are currently utilizing the current structures that are already available. That is, we already do routine immunizations, so we have facilities in the country, across the country, who do routine immunizations and have the sort of cold storage and all those structures in place. So the distribution therefore will be flawless because we're using the existing structures.
And perhaps let's first of all listen to what the health CS Mutahi Kagwe had to talk about or had to say in regards to the vaccine when it arrived on March the 3rd of this year.
This is a game changer for the war against COVID-19. As soon as these vaccines leave here, they are going straight to Kitengela, where we have got very good storage facilities. And from there on, it will roll out to the rest of the country, beginning with the regional hospitals, down to the level 4s, level 3s, and level 2 hospitals. And we will also be engaging the private sector, institutions, the hospitals, so that they can also assist. We are starting with our health workers. Kenya has approximately 400,000 health workers in the country. After that, we are going to roll out to other frontline workers. We have got the police, we have got the teachers and other people. After that, we are going to go to people with comorbidities, people who have got other infectious, people who have got other diseases, so that we can also protect them.
That is Health CS on 3rd of this month when he was receiving the first batch of the Oxford AstraZeneca vaccine at the Jomo Kenyatta International Airport, and he talked about the game changer in terms of COVID-19. But looking at the concerns that have been raised, Daktari, do you think perhaps it can hinder what exactly the CS has talked about, that this is a game changer and now at least we are able to far much fight COVID-19 vaccine now that we have the Oxford AstraZeneca vaccine?
Thank you for the question. So in light of the COVID-19 vaccine, the AstraZeneca vaccine in particular, in this case, we have seen that the WHO is actually recommending that we continue vaccinating. Of course, there are those concerns that have been raised regarding the side effects that have been reported in the Western countries, and they have temporarily halted their vaccine doses. However, in our setting, we have just started vaccinating. It's been just over a week or so, and we are of course, we are seeing their effects, but they're very mild. They're just common effects, such as the pain at the site of the injection, mild headaches, fatigue, nothing really serious. However, we have a safety and regulatory subcommittee in place within the larger task force group, which is monitoring this very actively. So in the safety and regulatory subcommittee, we have members from the Pharmacy and Poisons Board, who are actually the point person in this. The Pharmacy and Poisons Board have an active pharmacovigilance department who have not only been monitoring this particular AstraZeneca vaccine, but they have been monitoring various medicines as well as health products from as early as 2013. The monitoring system is both electronic and manual. So over the years, we have been developing the system. So right now, we just want to ensure that everyone who gets vaccinated and has any effects which are of concern should be able to report that in the system. We currently, when we're rolling out this vaccine process, we have an electronic logistic management system, Chanjo-KE, in place. And the Chanjo-KE system actually captures all those details: the batch number, your name, your contacts, any allergies that you may have, and any adverse events that you might experience. You may be able to report it then. You know, when you come in for the vaccination, you first come in, you're counseled, so that you could be able to, you know, it's not mandatory, so you have to give authority or authorization to get the vaccine. Then you go to the triage, and you're details are then put into the system. After that, you're vaccinated, and they keep you aside for about 15 to 30 minutes just to monitor in case of any adverse drug reactions, which may crop up at that point. Of course, protocols have been put in place in case there is such an event at the facility level. But further, after you leave the facility, if you go home and experience some adverse event following immunization, then you could always either call back to the facility, log into the Pharmacy and Poisons Board website, and be able to report the adverse event that you are experiencing. From there, the Pharmacy and Poisons Board is going to take it up. The Pharmacy and Poison Board, as well as the National Vaccine and Immunization Program, will be sort of compiling all these adverse drug reactions or adverse event following immunization processes. And there is a committee which has been put in place, which will be sort of looking at all this and checking out if there is something of concern for this population and for the country, and advise on the way forward.
Yes, the vaccine has been in the country for less than a month now. Have we had any serious cases, just like we have seen in other countries? And it has even led to them suspending the Oxford AstraZeneca vaccine?
No, not that. There's no reports of such. We just have the usual, as I was saying, pain at the site of injection, mild headaches. Some people actually don't have any effect at all.
Whatsoever?
Yes.
Talking about the county preparedness, we've seen a lot of the vaccination happening here in Nairobi, and especially in the media. What about the counties? I remember some health unions had talked about we were not well prepared, we were not informed, we've not been involved. And of course, there is a task force in place to take care of the COVID-19 vaccination program.
Yes.
How is the situation now?
So, as I mentioned earlier, we have a COVID-19 deployment plan in place. So the plan this COVID task force has various subcommittees which actually looks at very critical aspects of the rolling out of the vaccines. In the planning and coordination, we have the larger task force, right, which is a national task force, and as I've mentioned, the subcommittees. So what happens in the counties is that they're going to mirror such structures as well. So they will also have like county task forces headed by the county governors, as well as the county commissioners and other cadres. And then they will also have the task force itself, the subcommittee. So the subcommittee will obviously be chaired by the County Director of Health, and will have the various stakeholders, such as the county pharmacists, county EPI logisticians, health promotion officers, and there is a whole list of people who will be there. And that again will be mirrored back to the sub-county level. So it's a structure which is mirroring each other. If there's any problem at the sub-county level, it can be escalated to the county and then finally to the national task force, and from there we can just take it up.
And of course, the health CS did talk about this being the first batch. When do you expect the second batch, and how will it be distributed?
So the first batch we had planned for 1.02 million vaccines, which have already arrived. In the second phase, we are planning to have about 9.8 million vaccines, and subsequently in the third phase about 5 million vaccines. So of course the procurement and logistics subcommittee is working on that very actively. We are very proactive, and with our partners we are able to place an order and receive this vaccine from the Gavi COVAX facility, which is the one we're getting it through.
And talking of partners, last week India did donate 100,000 vaccines to Kenya. And of course, India is one of the worst hit countries by the COVID-19 pandemic. Kindly explain this kind of partnership.
I think the partnership says the cordial relationship between the countries. You know, we are always helping each other, and therefore it's just an extension of goodwill that, you know, that we're partnering together in this fight. You know, it's not only a Kenyan fight, it's a global fight. So we all have to leave our differences, if we have any, and get our hands together and work on this. We have to defeat this pandemic so that we could be returned back to the normal.
And talking of distribution, we've seen issues when we have KCPE, KCSE, when we have voting. There are some places which are not accessible. And not only are that accessible, now we have a vaccine that requires refrigeration. So how will this work out? And especially now that we're going to be having the 9.8 million batch coming in and the 5 million batch. Are we really prepared for that and for the distribution as well in remote areas?
So the plans are ongoing. You know, the first phase was a bit easier for us because we already have the infrastructure in place. The second phase will also be, we're going to still use the existing structures. Of course, right now we have limited facilities. But as we move into the phases, the facilities, the number of facilities who will be immunizing will also increase. We are also going to be utilizing the private sector, the FBOs, that is the faith-based organizations, as well as the NGOs to assist us in this. So we are working together. The number of facilities will also increase. That means that it could go as far as we can go. You know, we also have to look at the storage conditions, and therefore the facilities that we choose should have those that infrastructure in place, and also the staff there or the HR need to be trained on these vaccines. You know, it's a new vaccine. They need to learn how to use it and how it looks, you know, just so that they are on the same page.
And talking of people raising concerns, of course, I'm quite sure some people don't know a lot about the COVID-19 vaccine. Have you organized a way perhaps we can have civic education when we are airlifting ballot boxes, when we are airlifting examinations? Of course, we are hoping that we also be able to airlift these doses and be able to reach to the remotest corner of the Republic. But people also need to know about the COVID-19 vaccine, and especially now that we are having issues raised by even countries, and even some countries suspending the vaccine.
Yes, we are going to, of course, the communication will be continuous to educate the public on the importance.
Do you have one in place as we speak?
The communication aspect, or?
Actually, the civic education.
So we normally give education, because right now we're dealing with health workers.
Yes.
So the communication is actually channeled to them. So we do that in very specific ways, like through their, let's say, the associations.
Yes.
Right, so that we could reach our target audience. But as we progress into the other phases, we'll obviously be using other media platforms for this kind of engagement, so that everybody is on board and so that everybody can be able to access this vaccine and be able to find, fight the pandemic.
The concerns raised by countries, and even some have suspended the drugs, do you think that's a big blow, and especially when we need to make sure that each and every person can access a vaccine? And of course, if that clip is ready, my director can cue it in, because some countries, and yesterday other countries, and mostly we are seeing the picture playing out in Europe other than other countries. Of course, Africa, we have some few countries who have had some reservations, Uganda being one of them, and South Africa. But mostly we are seeing this in European countries, where of course all the vaccines, or majority of the vaccines are. Perhaps if that clip is ready, we can have a look at why some of the countries are raising concern. Of course, when it's ready, we're going to be dealing with that. Is it a big blow to actually the penetration of the vaccination program in Kenya and of course in the world?
To be honest, I don't think so, because as per the WHO guidance and the European Medicines Agency authority, the regulatory authority in Europe, they have said that they have identified only 30 of such cases vis-a-vis the dosing of the AstraZeneca to over 5 million people. So 30 is a small number compared to the 5 million doses. However, also it's been noted that there is no really causal relationship. It's not the vaccine which is causing the side effects as per the WHO recommendations and guidelines and their statement. So what is going on right now, which is the pausing of the vaccines in those countries and giving it maybe 14-day period to be able to investigate exactly what is causing. But currently the vaccine is not said to be causing those side effects. Even during the clinical trial process, those side effects were not even reported at that time. So this is a completely new thing. So that's why maybe they are halting to just be able to investigate to see if this vaccine is the one causing it. It may be that even without the vaccine, the general population would actually exhibit such effects.
And some people have asked why the AstraZeneca vaccine. Why don't we have a variety? We have Pfizer, we have Johnson's, we have Sputnik, we have others, of course. Why just AstraZeneca? Perhaps in Kenya we could have tried like 2 or 3.
Yes.
A variety?
So for the Pharmacy and Poisons Board to be able to register a vaccine or grant emergency use authorization, it first needs to be already been granted the WHO emergency use listing or any stringent regulatory authority use listing. So at that point, the AstraZeneca was the only one which had been given the emergency use authorization, the WHO one. So when they applied in Kenya, then the Pharmacy and Poisons Board did due diligence and did its own evaluation and granted the same. However, during the same period, we had the Sputnik 5, which is also, I believe it's already been granted the emergency use authorization as well in the pipeline. Okay, so we did not go for the Pfizer in the first phase because of the very stringent cold
storage.
Yes, the storage. We require like -70 degrees, right? So we don't have that kind of equipment right now. I know we have in some facilities, like maybe the research institutions, and they would not be able to actually store the 1 million doses. So that's the reason we were sort of thinking, we need to invest in equipment if we need to buy the Pfizer vaccine. The Moderna as well, it requires -20, but the AstraZeneca is 2 to 8, which is in our current setting, the normal vaccination range, so we can use our existing equipment.
And here in Kenya, we've seen some Kenyans also raise their reservations on the COVID vaccine. They're talking about when the president, his deputy, or the leaders, we haven't seen them taking. Even the health CS, we haven't seen him take the jab. And in some countries, we've seen, like in Rwanda, we've seen Paul Kagame. We've seen in Nigeria also, we also have seen 3 former and sitting presidents in the United States take the vaccine publicly. Do you think that can be a big boost if we see our head of state and perhaps a few leaders and our health CS take the jab?
Well, it probably would, but we are following our deployment plan. The first phase, we are very specific to essential workers. However, of course, if they would like, they would also get it. They are, of course, eligible in the second phase because they fall in that category mostly. But yeah, I think if the political let's say
the political elite.
Yeah, the political elite would like to take it, then they're most welcome. But as we had planned, because we're following the deployment plan which is in place, and because of the limited number of doses, we don't want to leave our health workers out there. They're the frontline workers, our teachers, when we have just limited doses for the first phase.
Of course, we are in the third wave. Some countries are talking about, like America, they're talking about anticipation of a 4th wave, but we will talk about that. Let's first of all hear why some countries have their reservations on the COVID-19 vaccine, and especially the AstraZeneca one.
The AstraZeneca vaccine over fear of thrombosis. However, authorities and experts say there is no link between the COVID-19 vaccine and blood clots. The European Medicines Agency, the World Health Organization, and the UK's medicine regulator all say the vaccine is safe to give and will review the claims laid. WHO says it's aware that a small fraction of people may have a severe allergic reaction to the COVID-19 vaccines, which is normal to any vaccine or drug. As a precautionary measure, WHO recommends that before the first dose, clients should inform the vaccinating team about any allergic reaction they may have had in the past. Oxford vaccine can be stored in a normal fridge, which makes it much easier to distribute. Uganda's President Yoweri Museveni says he's still contemplating on the continuity of the jab in his country. Kenya and some other African countries, United Kingdom, France, Australia, and latest entrant Georgia have continued with the rollout of the AstraZeneca vaccine.
And of course, the World Health Organization and also the AstraZeneca talking about the jab is safe, and all the complications that have been mentioned, they are not tied to the jab. And why is it that we are seeing a lot of European nations as opposed to Asian and perhaps North America and African nations giving the jab a wide berth?
So maybe it's just a precautionary measure on their part, because they have recorded such adverse events, and they would like to ensure and investigate that that is not the cause. Of course, some countries have identified specific batches of the AstraZeneca and are investigating on those particular lines of that particular batch. So that would be the reason.
And we've seen frontline workers receiving the jab. Have we seen here in the country frontline workers or even the security or the teachers raising their concerns and others skipping the jab here in Kenya?
Well, we are receiving the... Of course, right now we're still in the process of rolling out. We are also training the health workers. So far, I think the health workers, they know the importance of this vaccine and what it could do. It's a game changer in this pandemic. You know, the effectiveness of the vaccine will prevent you from getting, if you get the COVID-19 infection, it wouldn't be as severe. So keeping all those in mind, it's better to take the vaccine and be safe. And be safe, and let your family, friends, your loved ones also be safe.
Yeah. Last year, I think it was November or December, when the task force on the vaccination was tasked to actually start out a modality on how the vaccine will be rolled out as soon as it gets to the country. Where is that task force as we speak, now that we have the vaccines? And what are some of the successes that you can talk about that the task force has been able to achieve in the little time that we've had? So
the National Task Force on the COVID-19 deployment and vaccine deployment is still active, very active. We meet once every week to discuss. The task force has subcommittees, and their various subcommittees also meet weekly, planning and picking up the concerns or any hitches that may come across along the way, and then we discuss it in the larger task force and sort of like be able to mitigate those kind of risks. So yes, the task force is very active in that, and I would like to congratulate the task force for the rollout of the vaccine and the planning and distribution and the rollout. I think it's going on pretty well.
And the private sector, in the CS's speech when he was receiving the COVID-19 vaccine at the airport, he talked about they will be partnering with even the private sector. And of course, we will be waiting. And of course, pharmaceutical companies here in the country and also hospitals and private individuals would want to bring in the COVID-19 vaccine so that they may be able to administer and perhaps get some coins out of it. How do we ensure that that process is not skewed, or what kind of partnerships are you going to have? Because let's just be very, very fair, is that Kenyans, we have so many cartels and we have so many issues. We had the COVID, the COVID millionaires, and we also had issues at the KEMSA. So how are you going to ensure that as soon as the private sector has been given the green light to start bringing in the COVID-19 vaccine, that process is not skewed so that it may go in line with the task force and the ministry's agenda?
So before we move into the private sector, currently we are also leveraging on the private sector to distribute the COVAX vaccine, the AstraZeneca vaccine. We have partners with the private facilities that are also doing routine immunization vaccines as well. So we are engaging them. However, we are also planning to allow the private sector to be able to import the vaccine and distribute. However, we have not discussed discussions are still ongoing on how that will be done, and the protocols which will be, and the guidelines which will be issued by the National Task Force and the Ministry of Health will then be shared with everyone concerned.
Yes, and we just slightly, almost 2 weeks since the COVID vaccine arrived in the country. Of course, we cannot talk much about the successes and, of course, as challenges as the process is still ongoing. But what are some of the challenges that you have seen or are you looking forward to as we continue to distribute the vaccine?
Yeah, as you have well said, we're just 2 weeks old. The challenges have really not been there. Something glaring is not there. But however, we are working on continuously educating our health workers, capacity building them, so that they could be able to take up and roll out the vaccine seamlessly. Yeah. So that is the message that we are passing, that we need to work together as a team. All through, from the national, county and sub-county. Yes.
Indeed, and looking at social media, I can see Elia, Roba, you're watching, Charlo Emmanuel watching from Mombasa, Njimbe and James asked, why are they not wearing masks and even gloves during, I think it's because during the vaccination, we've seen the nurses.
Yes, they are wearing the masks, but they're not wearing the gloves, because it's not necessary. You're just giving an injection. There's no sort of invasive sort of procedure. It's just, yeah.
Of course.
And of course, they're sanitizing as per the protocols.
Okay.
Either hand washing or sanitizing before and after. Yeah.
Of course. Thank you, James, for that question. Remember, we are live on all our social media platforms. We see Isaac Chepli watching from Kericho, Ainamoy, Eric Petro watching live from Ndiwa, Homa Bay County, and Erico Petro also watching Channel 1. This is Channel 1. This is News Check. I'm Ben Troy Njue. Lensa Odingo is our sign language interpreter, and I'm hosting Dr.Nazila Ganatra, who is the head of Department National Strategic Public Health Programs. And today we are discussing matters COVID-19 vaccine, and of course the Oxford AstraZeneca, which is being used in the country currently. And there have been some of the concerns that have been raised by a number of people and also countries, some even suspending the usage. But Kenya, we are continuing with the usage, and everything, as Dr. has talked about, is everything is going on as planned. And you talked about the Oxford AstraZeneca. Are there any plans of perhaps having other COVID vaccines in the country in the near future?
Yes, as I'd mentioned earlier, the Sputnik 5, which was also granted the emergency use authorization.
The Russian one?
Yes. In Kenya. So so far it's been given the emergency use authorization. So as we're rolling out the AstraZeneca vaccine through the COVAX facility, we're also going to be discussing how these other vaccines can be brought on board.
Other than, of course, the Oxford AstraZeneca, we're also having a few partners. Who are other partners who are playing out in this game as we continue to receive more jabs and as we distribute them?
So we have various partners who are represented in the National Task Force, in the subcommittees, and they are assisting us in, in various areas, basically in all subcommittees. So we have got the UNICEF, we've got the WHO, we have got the Gavi and the CHAI and all other partners. So yes, we are working in collaboration with our stakeholders to ensure that this vaccine deployment is running seamlessly and smoothly.
Yes, as you've mentioned about emergency, and we know very well vaccines take years to develop, but we do not have that time. Do you think the risk is worth now that we have the vaccine and we have COVID, or we really need to do a little bit more research to know exactly what will happen, because we might have issues later in the coming years and nobody can foresee those or some of these problems that we may end up in?
So as you had said, the vaccines have not, okay, fine, they were developed within a short period of time, but those technologies have been existing in the other vaccines which we are using routinely. So it's just that this process has been expedited because of the situation we are in. We're in a pandemic, so we don't have the luxury of time. So I wouldn't say that they're completely new in terms of the technologies. It's just that the process has been expedited because of the situations we are in currently. Yeah.
Kenya is currently experiencing the third wave, and so other countries, others have had to observe more stringent measures when it comes to COVID-19. And of course, we have another threat, that is the new strains of the coronavirus that are currently, we've seen some in South Africa, and they have really ravaged that country. Should we be concerned? We just started the vaccination exercise, and of course we have the third wave, and of course we have the risk of new variants in the country.
So what I'd say is that we could take the vaccine, and that is going to assist us in reducing the severity of the disease. We are also going to continue we will continue with our health protocols, that is the social distancing, the sanitizing, the masking up. So therefore, and I don't think the variants have not been reported as such here, so we shouldn't be worried. Our borders are also being monitored very closely to be able to see that there are no infiltrations of people from other neighboring countries. Yeah.
We have seen the COVID-19 AstraZeneca vaccine is a 2-dose vaccine. And of course, we have seen the Johnson's is just 1. What happens to someone who just receives the first dose, and after the side effects, he feels, no, I'm not going to get the second jab? And is it actually one of the things that would actually be against what we are trying to do here, having the 2 jabs and making sure Kenya is rid of COVID-19 in the next foreseeable future?
Yes, so the AstraZeneca vaccine, as you rightfully put it, is actually a 2-dose vaccine. You first get the first dose, and then after a period of 8 to 12 weeks, you get the second dose.
You've talked about a period
8 to 12
8 to 12
yes,
weeks.
Yeah. 8 to 12 weeks, you get the second dose. So if you take the first dose and then you react, so you're not completely protected, because your protection actually comes after the second dose, the complete protection. So if you take the first dose, then you're not completely protected. It's very important for you to take the second dose as well. In the case of Johnson & Johnson, yes, it's a single dose. Currently, it's not been registered in the country. So once it's registered, maybe then we could be able to, maybe bring it through the COVAX system or through the private sector. But that's all dependent. Yeah.
Of course, somebody is asking, what is the difference of the vaccines? Of course, we will touch on that. Are you disturbed that we are on the third wave, but we are continuing to put down our guards as Kenyans when it comes to the war against COVID-19?
Well, we just, I think the public is sort of getting fatigued with the masking and everything, yes. So, but we have to reiterate to them that the war is far from over. We have to keep sanitizing, masking up, maintaining social distance, and then, of course, we have an additional preventive protective measure as the COVID-19 vaccine. So we encourage everyone to take
especially
it.
We've been seeing this in churches, in groupings, in meetings. Of course, the president did talk about let's not drop our guard. Of course, somebody was asking, what is the difference of these vaccines? We've have Pfizer, we have some have to be stored under very, very, very cold temperatures. Others have just normal, like the AstraZeneca one.
Yes, it's the different technologies which have been used to manufacture the vaccines, brings about the different the conditions under which they have to be stored. So different companies have done a lot of research in the various vaccination preparations that they have made.
Willie Rotich, you're watching from Nairobi. Elia You say you love KBC indeed. Thanks. If you have any questions, suggestion, or even where you are watching us from, we'll be more than delighted to sample some as we go on. Again, we are with Dr. Nazila Ganatra, who is the head of department at the National Strategic Public Health Programs, trying to put things in perspective, and especially when it comes to the just arrived COVID-19 vaccine, the AstraZeneca ones. Of course, there have been concerns have been raised on the same, and of course, now that we in our third wave, we really need to put our guards up. New corona variants, what should we do as a country to avoid having them? Because reports are out that some of the COVID-19 vaccine are not as efficient to the new strains of the virus that are replicating and are seen to be spreading more faster and more infectious than the COVID-19 that we know.
So we are closely, of course, monitoring the situation on the ground. We get reports on if there's any variants of these COVID-19 which has been detected. So far, I can say we are pretty much safe, but also we cannot really conclusively say that a particular vaccine is not effective against a particular variant. You know, studies have to be done, and the data of the studies will be able to guide us. So at the moment, we are currently using the AstraZeneca vaccine, and I think it's still effective against all the variants. We still need studies to show otherwise. The WHO also recommends the use for the AstraZeneca vaccine, even with those variants.
Yeah, from your professional point of view, should we also be open to explore other COVID-19 vaccines, like the Johnsons, like the Sputnik, as you put it?
Yes, so once they get the emergency use authorization in the country, then we could be able to explore its use. So far, since we only have the AstraZeneca one and the more recent Sputnik 5, we'll be working with those. But as the companies apply, the manufacturers apply for the emergency use authorization in Kenya through the Pharmacy and Poisons Board, and if they are granted the emergency use authorization, of course, after carefully monitoring the safety, efficacy, and the quality of the products, then we are open to looking at other vaccines.
And you are the head of the National Strategic Public Health Programs. I think this question should have come a little bit earlier. What are some of the mandates that you have or your department is having, and more so in relation to what we are dealing with right now?
So the National Strategic Public Health Programs Department has 4 divisions under it. We have got the National Vaccine and Immunization Program. That's why the COVID-19 vaccine is actually, we're one of the stakeholders in that. We also have the NASCOP, the National, and then we have the National, the TB program, right? And we have the malaria program. Yeah. And
Kenyans want to know exactly the timeline where we expect. Of course, we are doing this in phases, the healthcare workers, the security, the teachers, and perhaps the second and the third. When can you expect, like a normal Kenyan or an ordinary Kenyan than me, will receive the jab? When can I expect perhaps to get that jab, other than the 3 phases I've talked about, the frontline workers?
Yes, so right now in the 3 phases we're concentrating on the persons who are most at risk. So once we have, of course, that's just a plan of action, but once we get more doses and more people are willing to vaccinate, then the whole population can also be vaccinated. Of course, we're not going to be vaccinating persons under the age of 18 because of course, the studies have not shown the efficacy of that, and studies have not been carried out. So right now we're just focusing on the most, because the vaccines are for lack of a better word, they're not in abundant supply.
Yes.
So we have to prioritize our vaccinees, the persons we have to vaccinate. Yes.
Actually, that was supposed to be my next question: the age and those people who cannot take this jab.
So under the age of 18, right? Because there are no studies right now. In pregnancy, the studies have not been done yet on that. So it's unless if the doctor or the medic feels that the vaccine is more beneficial to the pregnant lady, but of course it's not recommended at the moment. So it's if the benefits outweigh the risks. Yeah, and then of course people over 50, we're giving them the vaccine, and persons over 18 who have comorbidities are at a higher risk. Yeah.
Indeed, you are watching Channel 1 News Check, and Rotich, you say you're watching from Nairobi. Eriko, thanks. County preparedness. Thank you for that question. County preparedness. I remember, I think it's a week ago, the Senate did convene a meeting. The Health Committee did organize a sitting with the governors, and they talked about they had not been so much involved when it comes they were not involved actually in the process of bringing in the vaccines, and the counties themselves have already been given the mandate to handle health issues in the country. Have we now actually been able to rationalize and put those two systems in one gear?
So in the National Vaccine Deployment Plan, we have a National COVID-19 Steering Committee, which is chaired by the Honorable Senator Mutahi Kagwe, CS of Health. And he has members in the steering committee, of which, of course, the counties are being represented as well. And falling back down on the actual deployment task force, we have members of the county, the COG represented. So especially in the, for example, planning and coordination subcommittee. So they are, of course, in the discussions, and as we are rolling out, we are also informing them of how this rolling out to take place. And now, from now, as I had mentioned earlier, there is the mirroring of those committees at the county and the sub-county level. So they are very much involved. We are, of course, continually training them, building capacity, so that we could be able to share the lessons learned. Yeah.
Talking of the third wave and looking at our country being one of the developing countries, of course, we have a lot of challenges, and especially when it comes to the COVID cases. Now we are registering over 700,000. Do you think that we should have perhaps more stringent measures and put in place to actually try and mitigate this? Because if you're talking about the third wave and we're talking about new strains that may land in the country, and of course they could be in the country, it's just that we do not know.
You know, we already have the protocols in place. As I mentioned earlier, the masking, the sanitizing, the social distancing. By stringent protocols, do you mean like lockdowns?
Not exactly. Okay, the last one actually did ravage the economy so much, but more stringent. We're talking about, the president talked about these measures, but we saw before he spoke on Friday, we saw political rallies, we saw gatherings. We've seen each and every person, each and every leader, and especially when we've been having by-elections. Should we first of all suspend some of the things that we are doing currently?
Yes, I believe that they were limited. The political rallies were suspended, and the gatherings for funerals and for weddings has also been limited to 100 persons. So yes, it's our responsibility as ourselves and to our family, our individual, our country, to be able to protect ourselves, keep ourselves safe. And we can only do that if we follow the protocols as laid down by the government. And then, of course, on top of that, we could also have the vaccines, which will further reinforce our protection. Yeah.
And looking at the laws that we have in the country, we've seen a lot of things being challenged as soon as they land. Do you think we really need some laws perhaps to govern how these drugs will later be brought in the country, so that we may actually help out Kenyans? We might see cartels taking siege and, of course, taking over the process.
Actually, the registration and the importation of the medicines is very stringent, and it is governed by the Pharmacy and Poisons Board. Of course, there is always the that aspect of what you're saying, that there might be some cartels.
Yes.
However, we are putting in a very strong monitoring system in place whereby we'll be monitoring all the batches, especially for the COVAX facility. Even the current system, the Chanjo KE system, it's also monitoring the stock levels and how the stocks are moving, as well as the batch number. So if, for example, you were to take the vaccine today, you will receive a message that you have taken a vaccine today at this time of a particular batch number. And then later on, while you're about to get the second dose, and it will remind you that you're due for your second dose. So we are tracking the batch number for the safety purposes as well. You know, for the ADRs, in case there's any adverse events following immunization, we need to know the batch number, and also for security in terms of pilferage and other sort of issues. So in case, you had mentioned earlier about the fake vaccines.
Yes.
So that would also sort of curb that, because the fake vaccine will obviously not have the batch numbers that are in the system. Yeah.
Somebody asks, after someone has been infected by COVID-19, after how long should they get the virus?
The vaccine?
Yes, I think I wanted to know if the person has had the jab.
Has had the jab.
Or after someone has been infected by COVID-19,
Yes.
how long should they, or can they get the virus?
Yes. So there could be two questions in that question. One question would be, if I've been infected by the COVID-19, am I eligible for a jab?
Yes.
Yes,
if you're
you
infected, not after you've already...
No, there are two questions. One is, if you were infected earlier, are you still eligible for the jab? So the answer is yes, because studies have shown that you could get reinfected.
Okay.
Right after the first infection. So yes, it's recommended that you get the jab. The second question that can come out from that question is, how long after, like if I'm infected right now, how long should I wait to get my vaccine? So that is after your symptoms are gone, after the 14 days of isolation or quarantine. So after 2 weeks of that, you're completely asymptomatic and you're free, then you can go and get your jab.
And can somebody get the vaccine when he's already has been infected by the virus?
Depends, because you know, if you're asymptomatic, but we'd recommend that you actually have it after, like 2 weeks after isolation, because you're already having the active disease. So your body is already sort of, immunity against it.
Indeed. But first of all, let's have a fast break. Of course, your questions, suggestions, or even where you're watching us from, highly welcome. We are hosting Dr. Nazila Ganatra, who is the head of Department National Strategic Public Health Programs, and of course the COVID-19 vaccine and its distribution falling squarely under her docket. We'll be right back. Let's first